3 weeks ago already, nurses, porters and general staff downed tools at the Doranginza Hospital in Port Elizabeth. Their concerns about insufficient protective gear is well-founded. A study of 138 patients hospitalized with COVID-19 in Wuhan, China, showed that 1/3 were health professionals.
At this moment, we don't have much. For some reason, the community wears the N95s and the surgical masks, but it's very difficult for us as doctors to get this in the wards. We have so little D-germ left, that is the alcohol we use to wash our hands, that we lock it up or we carry it with us, because otherwise we won't have. We also don't have masks. Every time when I ask for a mask, they are told to me we have no masks. Until I go to the storerooms and get the key for the storeroom, then they will be given a mask to me. But otherwise, the personnel there are not keen to give me masks, us as doctors.
Go to work, I fear not only my patients' lives, but I fear for myself and the fact that I directly put my loved ones at risk when I come home every day. Before the novel virus reached our shores, I knew we were not prepared then, nor are we now. With the current lack of even the most basic personal protective gear, such as face masks, gloves, and hand sanitizers, how will we even be provided with the more advanced gear such as the hazmat suits that we are supposed to wear according to the guidelines stated by our own health department when they have failed to provide that to us? Aside from the mere fact that we do not have the gear to protect us, how are we supposed to protect ourselves when the hospital does not disclose information to its own staff of local transmission of COVID-19 amongst its staff?
Medical personnel at 2 other hospitals, Glen Grey and St. Barnabas, also spoke out. At Glen Grey, the transfer of 19 patients from a lodge to the hospital sparked the protest.
They are risking their lives, compromising the frontliners of this particular department. They are risking it this way. One, the hospital itself is not ready to accommodate patients who have tested positive with coronavirus. One thing you'll note in that particular ward, that they have accommodated this patient, there is 1 toilet.
And then we move on to visit the ward, and we see the ward, there is no heaters. He said he's going to organize heaters from the offices and plug it there. There are no sanitizers. He said, no, there's a running water. So I said to him, this hospital is not fit to accommodate those people, but he insisted as if there's someone at the back holding a gun on his head.
A large number of masks, aprons, gowns and sanitizers from the National Department of Health is now being distributed in the Eastern Cape. Screening, testing and tracing in Nelson Bay Metro is also boosted with 15 additional vehicles. Vacant posts are also being filled.
On the basis of old posts which are funded for posts that are vacant, my view is that as I got to the department, I did find that there were challenges, where you'll find that vacant funded posts are not filled after people have left them. We're now starting to go back to normality in terms of saying if posts have been there, let them not die because of a baseline. And as such, we are now currently actually looking at filling of district officers' posts as at the level of senior management.
I've said to the MEC, if it means we must throw everything that we have, because this is where we have got a serious epicenter now, numbers really surging up, and we have said, let's pull together and minister on the team that is bringing. We'll be pulling those kind of teams, rapid response teams, to be in PE on the ground to ensure that we arrest the problem that is in PE of ongoing contraction of the virus and the spread of the virus.
The sharp rise in infections in the province is largely attributed to people attending funerals. A proposal is on the table to further limit the number of people attending funerals to only family and funeral service employees. Lerato Fekisi, SABC News, Port Elizabeth.